Hello, world, or to the one person that actually sees this. I think we're in a world of panic, and maybe this is my way of panicking, and it doesn't make it right, but it also doesn't feel wrong. I just feel like we need to be just a little bit more educated, and I don't mean educated as far as, big words and statistics and medical advice. What I have to say is simple, short, and to the point. Stop taking medical supplies. I have seen so many disheartening things, and I get it. I really, truly do understand why people are doing it. And at first, I thought about just coming on here and explaining the proper way of putting on a mask or how to take your gloves off. But the more I thought about it, I'm off today and I've had a lot of time to think about it, which is why I look a hot mess. But hey, it's appropriate because the world is a hot mess right now. But anyway, getting back to what I was saying, it just it just makes me upset to know that the people that are trying to help are being taken from. So, what I have seen are people stealing gloves, not one pair, two pair, but I mean like boxes. A box full of gloves. Not even the correct size, but as long as they feel that they've got something to protect them. And again, like I said, I understand it's a mental thing. You've got your gloves on and you feel like you can touch anything because your hands are protected. But while you're touching any and everything, you're going to grab those car keys or the house door key and have you wipe those down? I don't think so. And then you've got your mask on that you're wearing incorrectly. It's just extremely frustrating. I saw someone come into the clinic with an N95 mask on. Okay. We don't have one, but tell me who your sources are so I can get one. You come in with the N95 on. You're not even wearing it properly. You've got it upside down. And underneath that N95, you've got on a surgical mask. So it's not only, you're doing yourself a disservice, but you're also insulting the medical field. As I understand that you're trying to protect yourself. I get it. I don't fault anyone for that. But you just make it extremely hard for people in the medical field to help you because of lack of supplies, lack of respect. Forget the respect. We're gonna do our jobs regardless, whether you like it or not. We are here for you. You just giving us more of a challenge, which okay, challenge accepted. But if you're going to take from the healthcare professional, can you at least wear it properly? Plain and simple. Your mask should be covering your nose. I understand it doesn't cover your nose because you can't breathe. Hey, you want to commit? You got to commit 100%. That thing has got to cover the bridge. You got to tighten that wire part. The wire part should be on the bridge, not underneath the chin. You've got to squeeze that thing, and it's got to cover all of this, like completely. Hey, if you can't breathe, that is not my problem. You can't breathe either from COVID-19 or you can't breathe because you're wearing a mask. Like, seriously, pick your battles to complain about, okay? Because we've got to pick our battles on how we are protected. We don't have N95 masks. We have to go in there with surgical masks. If they are surgical, no, I shouldn't say if. They're surgical masks. But we've got to make sure, sometimes we don't even have the masks that have the droplets. Droplets, meaning, in layman's term, spit. So the spit that you can't see, that's in your eyes, in your nose, in your mouth from somebody standing so close to you talking and they're spitting. Those are called droplets. We've got to take a chance at that, and then we've got to try to find some gloves to put on. It's just extremely frustrating and disheartening. And it's just amazing at the things that I have seen that patients have gone to lengths to protect themselves. And I'm not going to say, if we had been doing X, Y, and Z before, we wouldn't be right here. That's irrelevant because we're already right here in this battle. But I would like to say, please stop using the bottom of your cane to push an elevator button, because there is a patient or a person that will use their finger to touch that exact same button that your dirty cane has pushed to use. And then that means they are grabbing the door, they are grabbing their medical card, whatever it is they are using, that finger is attaching to whatever it is that they're trying to pick up, and it's just causing more germs. I'm just frustrated, and I felt like I needed to get this out. And if I'm wrong, hey, I'm not the first, I won't be the last. And if this doesn't apply, let it fly. If you're offended, okay. I'm offended by people coming in, taking our supplies, but what can I do? Nothing but use social media to post and be upset about it. I'm still going to show up to work and treat you as if you are the only patient in the entire world. I'm still going to be a professional. And yes, when I walk out of that room, I might lose my mind and complain. And yes, when I get home, I will probably burst into tears because what in the world am I doing? I mean, that's just how I feel.